Hello, my name is Giulia. I'm Italian and I currently live and work in Berlin, where I work in the public health service of the city, and I'm in charge to take PCR, swab and samples in vulnerable groups such as women, victims of domestic violence, drug users, homeless and refugees. I decided to apply for this Infodemic course because last year, during the first wave of coronavirus, March 2020, I was stuck in northern part of Italy and I was overwhelmed by the huge number of fake news and misinformation that were affecting my community. For this reason, I think I want to be part of a network that can be really relevant to spread and to inform how the situation it really is. For this reason, I also decided to answer to a couple of questions that I found on the training page website. My first speaker will be on question 11. The project, in my opinion, will come along with several flaws, as it will only work for iOS phone, no Androids, and it leaves the 35 of feature phone user out. We can assume that feature phone users are elder population that unfortunately are the more risk. I would suggest for this a couple of solutions to make information available more widely. The first, it will be deploy also Android version. It's very important the feature phone messenger or they can get simple text messages with a very basic and straightforward language that it can be understood by everyone. We don't need to depend on high-speed internet because sometimes it's not even work, and we don't have to forget the radio and TV, especially for elderly people. That will be a part of the solution. My second pick will be on question 12. My prioritization for the question 12 setting will be as follows. We would explain how the value of wearing mask and distancing transform scientific evidence in an easy language and a language in school setting that can be reached by children, because children are excellent multiplicators, are good ambassadors, and what they learn at school, it can be spread in the family and it can gain more information and valuable information in the families. The second part is the hookah. It's regarding the hookah, the water pipe smoking, and this is concerning smoking hookah. It's really it's a topic because it's the opposite of social distancing. People can lose the risk of awareness, and smoking the hookah, you create a lot of aerosol because you share them with others, you smoke face to face. And the hookah it's a tube, but they're very difficult to sanitize, and the virus can survive inside of this. For this, we need to make a guidance available, for example, with WHO MRO guidance on hookah and COVID-19 will be very helpful. Last question is the ginger. The ginger advice seems less concerning, even if there is a ginger shortage in the supermarket, but it's still dangerous. People rely on protection, which in reality is inexistent. So we need to make clear those kind of message. I really appreciate your time. I thank you very much for your attention, and see you soon, Giulia.